All right, so my Vanna White this afternoon is Kelly Stallman, and she's going to be helping me with pointing out things as we move along. And I want to do a quick background on this. As most of you know, I've been doing this kind of disability advocacy work for about 25 years. And one day, I went to an Autism Society board retreat, and Kevin Custer, who's in the back, showed me this particular program called Inspiration that was just like, for me, oh my gosh, I can finally figure this out. So the next day I went to the office, I downloaded this program, and I just took all the stuff that I'd been trying to keep in my head for all these years and put it down into what at that time was called the green bubble chart. And what it's about is following the money. When I was looking up following the money, I found out that it was actually Deep Throat that first coined that phrase. And Deep Throat is from the movie All the President's Men. But it's a key issue for disability advocacy, for any kind of advocacy, because as Saul Alinsky says in this quote, if people don't think they have the power to solve their problems, they won't even think about how to solve them. And when you think about where the money flows, how it flows, where it comes from, and how it gets there, and how you can access it, that's where your power comes from. So I hope that makes sense. And now it will move. Hello. Okay, go to the next slide. Why won't it move? There. So as you all know, funding is in silos in Colorado. What I've learned over the years is that the funding actually came through us, it came by a way of history. So you've got the history of how funding was developed in Colorado, as well as the culture that was predominant at the time that funding stream came into being. So the funding is based on silos that were based on cultures and knowledge that we had in the past. So when you think about the medical funding stream that we have now, that was developed many, many years ago. It was developed based on physical things that you could see, and all of the structures that I'm going to be talking about and the patterns that I'm going to be talking about in the next few minutes were developed based on that old way of thinking that medical is just sort of a physical thing. Mental health and intellectual disabilities I put together because back in those days, and you have to think like 40, 50, 60 years ago, people with intellectual disabilities and mental health disorders were really scary people, right? Because we didn't know any reason about why these folks came into being. And so they have a separate funding cycle and silo because it's something that you can't see, and it's also something that people were really afraid of, that you could catch it, that something, those kinds of paranoias. Education funding was really about reading, writing, and math for many, many, many years. It still is even more nowadays with all of the testing and accountability standards that we put in place. And employment funding was really based on labor. And it started really from a completely different way of employment where people were into mining and farming and those kinds of things. A lot of the employment support situations, funding streams that we have came after World War II. And imagine how different the job market looked in right after World War II as to how the job market looks now. So it's, I just want you to have that perspective. I don't know why this won't do this. So many of these funding streams were created for institutional and facilities levels of care. They were not created for life in the community. We've adapted that, we've pushed that, we've nudged it, we've done a lot of things to try to make it more community-based. But when you get down to the original laws, the original rules, the original concepts, the original regulations, the original funding streams, it was all about funding medical kinds of care in institutions or facilities, right? So it was hospitals, nursing homes, ICFID kinds of facilities like Ridge or Pueblo or Grand Junction in Colorado. And I just learned this doctors were the captain of the ship mentality just a few weeks ago during the pediatric assessment tool, and this nurse who's been around since dirt, she said, that's what we're fighting. Because back in the old days, the doctor was the captain of the ship. Sometimes he was Captain Ahab. Sometimes he was a really nice kind of captain of the ship, but he dictated everything that happened within that facility. And if you look at our Medicaid system and many of our private insurance systems right now, they're based on that culture of the doctor being the captain of the ship. That's not how we're moving towards medical care anymore, right? We're talking about team approaches and medical homes and those kinds of things. There was a great speech that was given by a doctor to the graduates of the Harvard Medical School where he talked about that medical care now needs to be like a pit crew at a racetrack where the car comes in and, like I'm the car, and you have this pit crew that comes around you and supports your medical care. But that's not how the funding streams work. That's not how the laws work. That's not how the regulatory mechanisms work. So we have a lot of work to do around that. So what happened is that we knew facilities. I mean, back in those days, when my mom had me, she stayed in the hospital for 2 weeks. And it was an uncomplicated birth, nothing much. She stayed in the hospital for 2 weeks. Now, you're lucky if you're in there for 8 hours for those kinds of things. We've had drive-by mastectomies that people talk about. But all of these funding streams and rules and regs were developed based on this facility-based model, not on a community-based model, which is what we've been advocating for. So here's where we get to your little handout. This is the maze. This was the brain dump that I did with Kevin's wonderful software program. And I've adjusted it over the years, as you can see, but it is really a mess. Right? Right? And and I'm so glad you're laughing, because when I present this to family members, I do a presentation called Navigating the Colorado Systems. And I always put this up first because so many family members, myself included, I used to blame and shame myself because I couldn't seem to get the right services and supports for my kid. And I used to think, oh, I'm just too stupid. And I actually had a father-in-law who would say to me, oh, no, we pay for that. You just haven't called the right people, or you haven't done the right thing. As you can see, it's nobody's fault. It's very crazy making. Okay, so let's go through the maze.
Are you handing out magnifying glasses?
Yeah, I wish I was.
We struggled with this, both in printing and in presentation, so she's going to enlarge it a lot in sections.
So I call this
a
a
pointer. We're doing adaptive equipment.
Yeah.
It's double tasking.
That's right.
Yeah.
That's right. So I call this the basic civics lessons for disability advocates. Because if you don't understand how the money flows, you're never going to be able to influence the systems that are providing the supports and services, right? So we start at the very top with Colorado taxpayers, and you go down to the very bottom, and you'll see adults with disabilities who then get to access service providers, or children with disabilities who then get to access service providers. All of this in between is money flow, right? Now, if you look to the left, right, you see state taxes, is that your left? Yeah. So one of the important, I mean, in a basic civics lesson, one of the things you gotta know is this a federal problem on the right? Or is this a state problem on the left? You gotta know that. Because if you're going after a particular kind of issue or problem or concern, if you don't know whether it's the state law or the federal law that's impacting your choices, your decisions, you're going to be spinning your wheels and spending a lot of time doing something that really isn't going to matter in the long run, right? So you've got the state taxes and the federal taxes. Then on both sides of that equation, you've got a machination that happens, right? A massaging. So you have the state legislature, the governor, the Joint Budget Committee in Colorado. All of these guys get together and they create a budget out of the state taxes that you have contributed, that I have contributed, that all of us have contributed. We're a part of that work. They take our money and do something with it. Then when you go to the right-hand side, this pretty much the same thing happens. They take the federal taxes, they use Congress to develop the budget, and the president has a say in that, and they create a budget out of that, right? Then you go down to sort of the next level, and that's where you get into some of the allocations. So you have SAMHSA. SAMHSA, Miriam, what does SAMHSA stand for?
It stands for the Substance Abuse and Mental Health Services Administration.
Substance Abuse and Mental Health Services Administration. I'm just starting to learn about how the mental health system is funded. But that goes through there. You see the Center for Medicare and Medicaid, that goes through, that's for, as you can assume, Medicare and Medicaid. There's these other pockets. I mean, the DD Act is funded out of some of these other pockets. The DD Council is funded through some other kinds of mechanisms. And then you have the Individuals with Disabilities Education Act, which is another different funding stream on the federal level. And then as you go over into the state side, if I can make this move, you look at the different departments. And I'll show you in a minute that I haven't gone through all the departments. But you have the Department of Healthcare Policy and Financing, which is HCPF. They do Medicaid, all right? You have the Department of Human Services. They do a variety of different things. They used to do all the developmental disabilities stuff, but that's recently moved from the Department of Human Services to Healthcare Policy and Financing as a way to simplify some of this. And it actually did. When I readjusted my chart, it made fewer linkages, which is what we're looking at. The Department of Ed and the Department of Public Health and Environment is over here, along with the Department of Regulatory Agencies. These guys get funding to regulate. They get funding to make sure that everything's been, happening in the right ways. And then you see the Nurse Practice Act and the Division of Insurance under those gray guys. So as you start moving down this chart, you see that SAMHSA goes over here and it brings some of its money to the Department of Human Services, and then some of that money comes over to the Mental Health Center. But HCPF, Healthcare Policy and Financing, they also finance some of that for mental health through a mental health capitated contract. And then that money goes to a behavioral health organization that then finally goes to the mental health centers, right? And the mental health centers then maybe are going to help you with your mental health stuff. You take the Center for Medicare and Medicaid, they're sending all their funding, supposedly, to the Department of Healthcare Policy and Financing. But what do they do with it? They get, some of it goes into home health, which is a state plan benefit. Some of it goes to nursing homes, which is a fairly direct thing. They've got a lot of impact with CDPHE and the regulatory people. But right now, then they send their stuff to the Division for Developmental Disabilities, who then moves it over to the community center boards, right? So these purple people, the purple people eaters, I've made these guys purple because these guys are sort of the case management single entry point agencies. These are the people that we generally interact with as family members or as people with disabilities to try to get services in our state. But we don't have a single entry point. We have multiple entry points, right? And the independent living centers don't really have a lot of case management responsibility, but they do have a lot of information and referral, and they have a lot of resources and training kinds of funding that allow people people with disabilities to get the supports they need. So as you can see, as we move down here, then we get into our waivers. And I've put all of our waivers in sort of a cream light yellow color. So in Colorado right now, the single entry points, which in this particular county, Arapahoe and Douglas, these are the, it used to be long-term care options, but it's now Colorado Access, right? They handle these community, home and community-based waivers. They do traumatic brain injury, they do the EBD waiver, they do, come on in. Yeah, come on in. They do people living with AIDS, spinal cord injury, and mental health. Okay? You come over here, and you see the single entry point also is going to do the Children's Home and Community-Based Services waiver. Sometimes. But sometimes the CCB does that. It just depends on who you want to have do it. The community center boards, up here in the purple, they do the Children's Extensive Support waiver, the Children with Autism waiver, and they do the other DD waivers, which I'm trying to get to, which is the HCBS DD or comprehensive waiver, and the supported living services waiver. Now, finally, after you get through all of these different machinations, you get approved for services, right? Under the service provider bubbles, we could put a whole bunch of other lines going out, because in Colorado we believe in competition and all of those kinds of things, and choice. So there's many service providers you can choose from that you're now finally able to pay after you've gone through this incredible maze. So what do you think happens to the money? When you pay your Colorado taxes, right? We're up here. You paid your taxes. You paid $10, say. What do you think happens as that $10 goes through all of this? Yeah, 10 cents here, 5 cents there, because you have to administrate all that, right? So each one of these bubbles has different rules, different regulations, different laws, different funding streams. So like the Children with Autism waiver, Betty, that's funded by what?
Oh, that was funded by the tobacco funding.
Yeah.
Yeah.
So it was tobacco tax money that we were able to earmark 10 years ago or whatever to get the Children with Autism waiver funded. And we created a Children with Autism fund or something like that, that only can be used by the services under that waiver. So as you think about all the machinations, right, is it any wonder that when you get down here, there isn't a lot of money left over to pay that person who comes in and gives you a shower in the morning and puts your brace on you and makes sure that you're able to brush your teeth and all those kinds of things. Because all of these have taken a piece of that pie. Right? Any questions so far? Anything you see that I've missed?
I think of it as a pinball.
It is like a pinball. It goes bing, 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 and then you go back and forth and up and about. So can you see why when you're trying to get something to happen for yourself or your child or whoever, you're kind of going, whoa, wait a minute, why is this so hard? Why is this so difficult? Okay, so here's the way I think about it.
Carol, can I ask a quick question?
Absolutely.
When you look at most of the money flows into DHS or HICPA, what percentage of dollars flow where? And is it mostly going into DHS, mostly HICPA? Where's the bulk of the money?
Well, that's a very good question, right? And who, when you look at that, at the green people up at the top, those are the people that determine how it gets allocated. So the legislature and the Joint Budget Committee and the governor are all very important people to us, because they're going to take that first cut of the bulk of the dollars that are coming in and allocate that, right? But the percentages, I have no clue, Kevin. I don't even know how you would find out, to tell you the truth. But it would be an interesting exercise.
The match from the feds, too.
Oh, right. So with Medicaid, in Colorado, Medicaid is 50% federally funded, and I don't know why that does that. And so when you see that Medicaid there's money coming from the budget, the Colorado budget to the Department of Healthcare Policy and Financing, and there's money coming from the Centers for Medicare and Medicaid to the Department of Healthcare Policy and Financing. That's sort of the second cut, right? That's maybe the first or second time that our taxpayer dollars have been cut into our budget. In Colorado, it's a 50-50 match. Now, many of you have heard about the Community First Choice Act, which is part of Obamacare or the Affordable Care Act. And that would allow us to get an extra 6% match from the feds for certain services that a bunch of us are hanging out at long meetings working on, trying to figure out what that might look like if we add services to the state plan. And an extra 6% match from the feds is considerable, right? So that's something we really want to work on. But yeah, I would love to put dollar factors to all of these. But as you can see, each one of these is taking their piece. So then if we go back to this. Oh, I just wanted to show you what's not included. Please. How
Can you
irritating.
use your forward
It won't,
arrow?
maybe that's what it
Yeah,
wants.
just use that,
There it goes, thank you. It used to be the return would work for me.
yeah.
Okay, so what's not included in that maze of a map of a mess of a thing, right, is HUD, Housing and Urban Development. I don't know where that money comes from, but I know it comes from somewhere, and I know it's mostly federal and there's some state dollars attached to it. I know that's extremely important for people with disabilities, because if you can get a low-income housing voucher, a Section 8 voucher, you have a lot more power and control over your life than you do if you have no help for rent, especially when you think about how much rent costs. County mill levy money. We have about $10 million that comes from the Arapahoe and Douglas counties in this part of the world, that comes from county mill levy folks, us as taxpayers, that we put into that fund. That's not included in that maze. The natural supports. So, you know, when this happened to me, my husband is now giving me a shower. He never gave me a shower before, except for a long, long time ago when we used to shower together, right? But lately, that hasn't happened as much as it used to, right? But now he's not getting paid for that. That's totally a natural support that he's coming in there and he takes my neck brace off and helps me do all that stuff. My neighbors that saved me that day, those guys didn't get paid for that. They were a natural support. Once the EMTs got there, then the system started taking over, right? But all those kinds of things are not a part of that whole chart. Home care allowance, it comes out of the state. It's not very much money, but I just haven't figured out how to get it in there. There's also something called the Colorado Real Property Expense Assistance thing that it gets you like $60 a year maybe for somebody with a significant disability. I have the application if you ever want to look at it. I've never filled it out for my son or anybody else, but it's another resource, right? It's another taxpayer-funded resource. And the other piece that's not in there is the whole Social Security Administration. So SSI, SSDI, Social Security Disability Income. That's taxpayer funded. It's funded by all of us. And I just haven't figured out a way to put that into that chart. And believe me, after doing this for 25 years, I learn something new every day. There's always a resource I find that I didn't know about. And yes?
Excuse me for my ignorance, but what's the difference between home care allowance and home health?
Oh, that's a very, very good question. Home health care is a state plan benefit out of Medicaid. And home health care pays for registered nurses, licensed practical nurses, certified nursing assistants, and OTPT speech kinds of services, if you have a level of care that qualifies for home health care. This is a prime example of a system that was developed out of that old the doctor is the captain of the ship, as well as this is the way we do it, and we're not going to do it any other way. It was never based on community-based care. It was always just sort of, oh, well, this is the way we do it in a nursing home. Let's just take that and do that in somebody's house, which doesn't work very well, right? Home care allowance has been around a long time, like before a lot of the waivers, actually. It's a state-only benefit. It's funded, you access it through the single entry points, usually in your county. It depends on where you live. And it's some funding that is for poor people to be able to help pay for their personal care. So like, somebody to come in and brush my hair because I'm not supposed to reach up over my head. Somebody come in and do some laundry and things like that because I can't bend over. All of those kinds of personal care, hygiene, brushing teeth, those kinds of things. It's not very much money. It's usually about $200 or $300 a month. It's a very flexible funding source, which is really, really nice. But it just pays for what that particular definition of personal care is. Is that how? You're welcome. Feel free to interrupt me at any time. Okay. Yes. The courts. Another good. That's another thing we pay for. It's another thing that interfaces within the disability system way more than we wish it would. We have lots of people where the police and are the first responders for folks with behavioral disorders who then end up going to court and then end up getting in the whole law enforcement system. Those are also paid for by, I don't know how that funding stream works, right? I've been trying to find it out, but I don't know.
It's in the budget.
So the state patrol is in the Colorado budget, but the county sheriffs, I think they're mostly funded by county mill levy dollars or property taxes or sales taxes or whatever. The courts are funded by counties, I'm pretty sure, because I know in Jeffco, where I live, they got cut pretty bad during the recession, and people were having to wait a long time for courts. But yeah, it's another funding stream that is not a part of this chart. And as human beings, all of us as human beings interface with that. Unfortunately, as folks with disabilities, I think, end up interfacing with those systems more often because it's always not always, but the majority of time, it's a publicly funded resource, right?
And Carol, your disability doesn't protect you from being busted.
No, your disability does not protect you. Just because you did, ignorance is, what do they call that? Ignorance of the law is no defense. So even though, you may have a cognitive disability that makes it so that you really don't know that you broke the law, it doesn't make any difference. Yeah, that's not going to protect you in a court of law. You can sometimes, except for the death penalty, right?
One exception.
Right. But you can still go to jail, just like anybody else. So these are my ideas about what we can do about it. I hope after looking at that mess that you think we should do something about it. But these are my ideas, and I'd be very interested in listening to what you guys think about what can be done about it. First of all, I think we need to simplify, because every time you go through one of those places, for all 12 of our Medicaid waivers, we have more Medicaid waivers than any other state in the United States. But each one of those waivers requires somebody to manage that waiver, to report on that waiver, to collect data on that waiver, to send in the waiver application, to send in the renewals. They have to manage that particular waiver. I mean, when Betty and I did the Children with Autism waiver, we were hoping it would be for like 900 people, weren't we? That was our first cut.
Yeah.
And it ended up being for 75 kids. And to end up having, it probably costs more to manage that waiver than it does to do it in many ways. Because, there's, what do you call that, Tim, when you've got, you put enough things together, you get some efficiencies.
Critical mass.
Critical mass, yes.
Economy of scale.
Economy of scale. So,
Also, Carol, the funding stream for that
Yes.
waiver was determined when the bill sponsor left the room to go get her picture taken on the front steps, and another legislator came up and said, I have an idea, and it was over. And they voted.
right. Right. Where they find the money sometimes, if you've been working on our Capitol Hill for any period of time, it's always been about, you know, you got to find a funding stream. You got to find some money for any new project that you put together. And like Betty was just describing, when we were trying to find money for the Children with Autism waiver in 2004, the prime legislative sponsor went out to get her picture taken, and some other legislator walked in with a funding stream that made it work. So you just never know where all of these dollars go. I mean, even that mess that I gave you was a handout. That seems incredibly complicated, but it's probably 100 times more complicated even than that, right? I think we've got to understand the history. We've got to understand how we got what we've got. Because if we don't understand that, that's been the big problem with the recent pediatric home health assessment tool work that we've been doing with healthcare policy and financing. And I don't know how much you all know about that, but it was a situation where advocates had worked very hard to get people, you know, we keep pushing the envelope, right? We keep trying to make things broader and better and work for people in the community, in their homes, in their schools, in their jobs, wherever they want to be. And we kept pushing that envelope, and luckily, while we were pushing, the department wasn't looking very carefully at what the law actually said. Then they came back and went, oh my gosh, we have to abide by this law, and what the Department of Regulatory Agencies says is this law, and oh my gosh, we're way out of kilter here. So understanding how we got there is critically important, because we had a whole bunch of people yelling at healthcare policy and financing when they were following the law, right? And they have to follow the law. So as advocates, as we're, you know, getting back through this maze, we really have to figure out who's responsible, because it wastes our time, it wastes their time, it wastes tons of money to be yelling at a bunch of people who are just abiding by the original law or the original history of the law. So we want to go after the right person at the right time. And we want to be working on the thing that actually is going to fix or change the situation for people on the ground, which are the folks we care about, not spend, what, has it been 4 or 5 months we've been working on this? Since last November, so longer than almost a year. And then follow the money. So each funding stream has administrative costs, and I think we should get rid of some of the bubbles. I really do.